Beneath the sterile surface of medical science, a chilling truth lurks, where trust and ethics were shattered in the name of progress, power, and curiosity. Doctors, scientists, and researchers, the very people we entrust with our lives, became perpetrators of unspeakable horrors. These stories are not just about medical malpractice, but about lives destroyed, minds broken, and the haunting aftermath of experiments that crossed every moral boundary. In these dark chapters of history, the line between healing and harm blurred beyond recognition, and the victims, vulnerable, powerless, forgotten, became pawns in grotesque tests. Institutions, governments, and authorities that should have protected them instead condoned or ignored their suffering. The following tales are not fiction. They are real, terrifying accounts of the most shocking medical scandals in history. Prepare to step into a world where science went terribly wrong and lives were lost to ambition, cruelty, and greed. The Tuskegee Syphilis Experiment, a silent death. It all began in 1932, a time when the world was still reeling from the Great Depression, and medical science, while advancing, had little regard for certain groups of people. The American government, in an effort to study the long-term effects of syphilis, embarked on a project that would become one of the most notorious and horrifying medical scandals in history. Tuskegee, Alabama, was the chosen location, a small town where racial inequality was rampant, and the public health care system offered little to the marginalized black population. The men who would become part of this horrific experiment had no idea what they were about to endure. Poor and uneducated, they were living in a world where they had little power over their own lives. They were told they were being treated for bad blood, a term used loosely for a variety of illnesses, from anemia to syphilis itself. The promise was enticing: free health care, transportation, meals, and even a stipend. To men struggling with poverty, this sounded like a blessing, not realizing they were entering a nightmare from which there would be no escape. The government, working with the Tuskegee Institute, told these men they were participating in a study to understand how untreated syphilis progressed over time. The doctors said they would be given treatments, but in truth, the men were receiving nothing but placebos, a mixture of ineffective medications. They were never told they had syphilis, and as the disease ate away at their bodies, no one stepped in to stop it. Over the years, the study's true nature became clear to those who knew about it, yet no one dared to expose it. The men, some of them in their 30s, started showing signs of the disease. Rashes, sores, and headaches became commonplace, and as the disease spread, their bodies deteriorated in ways that seemed too horrific for even the most experienced doctors to ignore. The doctors didn't intervene because they wanted to see the natural course of the disease, as if these men were merely subjects in a gruesome laboratory experiment. The town of Tuskegee, a quiet southern place, carried on as usual. The doctors and officials involved in the study continued to pretend that they were acting in the best interests of the patients. They justified their actions by rationalizing that these men were part of a valuable study, one that could potentially advance medical knowledge and aid in future treatments. But as the years dragged on, it became harder to ignore the suffering of these men, the slow and painful deaths that seemed to come without reason. What the doctors failed to anticipate was that people talk. They talk to their families, their friends. Word began to spread that something was terribly wrong. The men who were part of the experiment started dying, their bodies ravaged by the syphilis they had been left to endure. Some of them never knew they had the disease. Others, too afraid to speak up, endured in silence. The wives and children of these men were affected too. Many were infected unknowingly by their husbands, passing the disease down through the generations. Infants were born with congenital syphilis, suffering from birth defects, disabilities, and death, the legacy of a cruel experiment. By the 1960s, The truth about what was happening in Tuskegee began to leak out. A brave whistleblower, a concerned public health worker who knew the experiment was wrong, tried to bring attention to the atrocity, but his voice was drowned out. It wasn't until 1972, when an investigative journalist named Jean Heller from the Associated Press uncovered the full scope of the disaster, that the public learned the truth. The revelations were horrifying. The experiment had lasted for 40 years, far longer than anyone had anticipated. By the time the truth came out, over 100 men had died, and hundreds of others had been left to suffer. The media storm that followed was nothing short of a public reckoning. The public was shocked, outraged, and devastated by the betrayal of trust. The survivors of the experiment were left broken, their lives irreparably damaged. Many had lost their families, their livelihoods, and their dignity. They were offered settlements, but no amount of money could ever heal the deep wound that had been inflicted upon them. The apology came too late, and the anger of the black community, still reeling from the legacy of racism, was palpable. The scandal was not just about a medical experiment gone wrong. It was about a system that had intentionally dehumanized an entire group of people. The Tuskegee Syphilis Experiment remains one of the darkest chapters in American medical history. The lasting impact is still felt today. The scandal led to reforms in the ethical treatment of human subjects, and the study itself became a symbol of the dangers of unchecked medical power. The legacy of Tuskegee serves as a grim reminder of how easily trust can be violated when human lives are treated as expendable. Dr. Michael Swango. The doctor who killed. Dr. Michael Swango was not always the monster he would become. At first glance, he appeared to be the model of a successful, intelligent, and caring physician. Born in 1960 in a small town in Illinois, Swango seemed destined for greatness. He was driven, ambitious, and excelled in his studies. It seemed almost fated that he would enter the medical profession. He was charming, personable, and earned the respect of his peers. But lurking beneath this veneer of respectability was something far darker. Something so sinister that it would take years before the full extent of his crimes came to light. Swango's fascination with death began long before he entered medical school. In fact, it had been a pattern throughout his life, one that his family and friends would later recognize as a chilling prelude to the horrors he would eventually commit. As a young man, Swango had already shown signs of a deep, pathological obsession with violence and death. He would take morbid pleasure in discussing death, often speaking with cold indifference about the suffering of others. But it wasn't until Swango began his internship that the true extent of his depravity began to surface. His early years as a medical professional were marked by a disturbing number of unexplained patient deaths. Initially, these deaths seemed like random occurrences, a consequence of the unpredictable nature of medicine. But as time went on, it became clear that there was something more sinister at play. Patients under Swango's care seemed to die under unusually suspicious circumstances. Some died of heart failure, others of complications related to anesthesia. Yet the pattern was undeniable. It wasn't just the patients he killed. Swango also poisoned his fellow medical staff. Colleagues began to report feeling ill after working alongside him, suffering from unexplained bouts of dizziness, nausea, and weakness. It became apparent that something was wrong, but Swango's charm and his ability to evade suspicion kept him from being caught. The horror of Swango's killings wasn't just in the sheer number of victims, but in the way he orchestrated it all. He was a master of manipulation, using his knowledge of medicine to cover his tracks and cast doubt on the cause of death. He would poison his victims with lethal doses of toxins, carefully selecting his victims from among those who were vulnerable or already suffering from health problems. Swango's ability to operate under the radar for so long was a testament to his cunning and the degree to which the medical system allowed him to manipulate his position. But eventually, the walls began to close in. Suspicion mounted, and Swango's own behavior became more erratic. His colleagues began to notice the signs, the strange coincidences, and the growing number of unexplained deaths. In 1997, he was caught after a patient died under suspicious circumstances, and authorities finally began to piece together the grisly pattern of his murders. Swango's arrest was only the beginning of a nightmare that would unravel over the next few years. It turned out that his killing spree stretched back years, perhaps even to the time before he became a doctor. He had a history of poisoning, dating back to his time as an intern, where he had killed multiple patients and colleagues in a chilling game of life and death. Swango's trial was a media sensation, a case that gripped the public's attention with its sheer horror. He was eventually convicted of several murders, but it is believed that he may have killed up to 60 people in total, an entire lifetime of violence hidden beneath the guise of medicine. To this day, his true number of victims remains unknown, a dark cloud hanging over his legacy. The Philadelphia Experiment, a medical nightmare. In the 1950s, as the Cold War tension loomed over the United States, a dark chapter in medical history was quietly written in the city of Philadelphia. The place, the University of Pennsylvania. The experiment, one of the most chilling violations of human rights ever committed in the name of scientific research. In the midst of post-war fear and paranoia, the U.S. government authorized a program under the guise of medical experimentation that would forever tarnish the reputation of the medical field. The story begins with the development of mind control experiments, supposedly aimed at understanding the human brain and its susceptibility to suggestion, hypnosis, and drugs. The military, convinced that controlling the human mind could provide them with an advantage during the Cold War, enlisted the help of some of the most prestigious medical institutions to begin their covert studies. What followed was a series of unspeakable human experiments conducted on innocent patients, vulnerable individuals who were either unaware of the sinister experiments or powerless to resist. The medical professionals who participated in these trials were complicit in what can only be described as a horrific descent into unethical experimentation. The method? They used electroshock therapy on patients combined with hallucinatory drugs, often without the patient's knowledge or consent. The drugs included LSD, a powerful hallucinogen, which was given to patients in shocking doses to explore the effects on their consciousness. The goal was to study the brain's response under extreme conditions. But what no one anticipated was the irreversible trauma that these drugs, paired with electroshock treatments, would cause to the minds of the patients. Many of the subjects were simply mentally ill patients, already vulnerable and under the care of the hospital. As the experiments progressed, the doctors involved became increasingly disconnected from the humanity of their patients. The subjects were treated as little more than objects for testing, their pain and suffering ignored in favor of scientific curiosity. The disturbing aspect of the experiment was the complete disregard for the patient's well-being. Doctors and researchers were not interested in healing. They were interested in testing a theory, one that could alter the course of history, at any cost. One of the most horrific incidents involved a young man named John, a patient suffering from schizophrenia, who was chosen as a subject for the tests. Unbeknownst to him, he would soon become part of the dark medical experiment that would forever shatter his sanity. He was given high doses of LSD while strapped to a chair in a sterile room, surrounded by men in lab coats who were taking notes on his every twitch, every scream. For hours, John was forced to endure his hallucinations alone, his mind twisting and contorting as the drug took its toll. The experiment took a dark turn when the subjects began to show severe psychological trauma. Some became catatonic, others experienced violent psychotic episodes, while a few had their minds irreparably damaged. No one knew how to reverse the effects. The patients, whose trust in the medical system had been violated in the most horrific way, were left to suffer in silence. Yet the experiment continued, its tragic momentum unchecked. As time passed, more and more patients began to lose their sense of reality, and the trauma became apparent. Some attempted to commit suicide, unable to bear the horrific experiences they'd been subjected to. The hospitals began to see an influx of damaged patients, yet the researchers turned a blind eye to the growing signs of devastation. It wasn't until years later, when a whistleblower from within the program came forward, that the full scale of the experiments was revealed. The public outcry was swift and intense. Once the details of these mind control experiments were exposed, they caused shockwaves throughout the medical and scientific communities. The fallout was brutal. Lawsuits were filed. The patients, many of whom had been harmed beyond repair, sought justice. But by then, it was too late. The damage had been done, and the true extent of the experiment's horrors came to light. The scandal led to a re-evaluation of the ethical standards in medical experimentation, and it inspired reforms in the way research involving human subjects would be conducted in the future. Yet for the victims of the Philadelphia experiment, the story never truly ended. Their lives had been destroyed by a system that had promised healing, only to inflict unspeakable harm. The dark truth of these experiments remains a haunting reminder of the power of unchecked scientific curiosity and the terrifying consequences of using human lives as mere pawns in a game of research. The death of Autopsy. Dr. John Money's gender experimentation. Dr. John Money was a name synonymous with the field of psychology and sexology in the 20th century. For years he was considered a pioneer, a revolutionary figure who challenged traditional understandings of gender and sexuality. Yet, beneath the accolades and his carefully constructed reputation, there lay a darkness that would come to define his legacy. The story begins in 1966, with a tragic accident involving a young boy named David Reimer. David was born in Winnipeg, Canada, in 1965 as a healthy baby boy. However, when he was just 8 months old, he suffered a catastrophic injury during a routine circumcision. A botched procedure left David with severe damage to his genitals, and his parents were told that he could no longer live a normal life as a boy. Faced with this heartbreaking situation, they sought out Dr. John Money, a well-known and respected psychologist at Johns Hopkins University, who had previously claimed that gender identity could be shaped by societal influences and upbringing, even from infancy. Dr. Money, with his renowned theories about gender being fluid and malleable, suggested that the only way for David to lead a normal life was for him to undergo a gender reassignment surgery. He recommended that David be raised as a girl, adopting a new identity, Brenda, and never speaking of the accident. Money claimed that gender was a social construct and that a child's identity could be molded through upbringing and experience, regardless of biological sex. What followed was a cruel and tragic experiment that would leave a permanent scar on the Reimer family, especially David. The surgery was performed, and David was raised as a girl, with Money overseeing the process. The family's every move was monitored, with Dr. Money making frequent visits to ensure that David was adjusting to his new life as a girl. But it was an experiment doomed from the start. As David grew older, the trauma of the gender reassignment became clear. He never identified as a girl, no matter how hard Money and his parents tried to enforce the new identity. David began to show signs of distress, exhibiting masculine behaviors, and struggling with a deep sense of confusion and alienation. He rejected his female identity and began to resent Dr. Money's meddling. But Money, determined to prove his theories, insisted that the experiment was working, that David's struggles were merely part of the process. The horror deepened as David reached adolescence. He was bullied by classmates who sensed his discomfort, and he faced an increasingly difficult time trying to reconcile the gender he felt inside with the identity that had been forced upon him. His psychological trauma deepened, and by his teens, he attempted suicide multiple times, unable to cope with the emotional and mental strain of living a lie. Dr. Money, rather than recognizing the profound damage his experiment was causing, continued to manipulate the situation, denying the failures of his theory. In his professional arrogance, he insisted that David's distress was merely a phase, a temporary issue that would resolve over time. But the pain was irreversible. Eventually, David's family, desperate for a solution, revealed the truth about his past to him. The damage had been done, but David, now an adult, finally reclaimed his identity as a male. He had gender reassignment surgery as an adult, but the psychological scars from the years of abuse and confusion never fully healed. David, now known as David Reimer, spoke publicly about his tragic experiences, and his story became a poignant and heartbreaking example of the dangers of scientific arrogance and the dark side of medical experimentation. David's death at the age of 38 was a result of a self-inflicted gunshot wound. His struggle to come to terms with the cruelty he had endured, the pain of living in a body that didn't align with his true self, ultimately led to his tragic end. Dr. John Money's legacy, which had been built on the back of this horrendous experiment, would be forever tarnished. His work was discredited and his reputation destroyed. The story of David Reimer and Dr. Money's cruel experiment remains one of the most chilling examples of medical malpractice and psychological manipulation in history. It serves as a stark reminder of the dangers of treating human beings as mere subjects for experimentation and how science, when untethered from compassion and ethical principles, can lead to devastation. The Nuremberg Trials. Nazi medical atrocities. In the heart of World War II, a time when the world was plunged into chaos and unimaginable suffering, a group of doctors and scientists in Nazi Germany carried out some of the most horrific experiments in history. These experiments were designed to test the limits of human endurance, as well as to carry out the twisted ideologies of the regime in power. What happened during these dark years would forever change the way humanity viewed medical ethics and the role of science in society. At the infamous concentration camp of Auschwitz, Dr. Joseph Mengele, a name forever synonymous with evil, carried out some of the most grotesque medical experiments known to man. Mengele, a trained physician, had been tasked with determining the racial purity of prisoners and performing experiments that were, in his twisted mind, aimed at advancing Nazi ideology. The experiments were often carried out without anesthesia or any consideration for the pain and suffering of the victims. Mengele's experiments included freezing experiments, where prisoners were subjected to extreme cold to see how long they could survive before dying, and twin experiments, where he subjected twins, often children, to horrific tests, injecting them with various substances to study their reactions. Many of these children died as a result of the experiments, and those who survived were often maimed for life. The most horrific part of Mengele's experiments was the complete disregard for human life. The victims were often selected randomly, with no regard for their health or well-being. They were taken from the death trains, subjected to inhumane conditions, and then experimented upon like lab rats. Their suffering, both physical and psychological, was immense. As the war progressed and the Nazis' hold on power began to crumble, the atrocities committed by the doctors in the concentration camps became known to the world. After the war, at the Nuremberg trials, a series of doctors and Nazi officials were put on trial for their involvement in these atrocities. The trials were meant to hold them accountable for the medical crimes they had committed, but for many of the victims, justice was never truly served. Mengele himself managed to escape capture and lived out his days in hiding. The Nuremberg trials served as a turning point in medical ethics, leading to the creation of the Nuremberg Code, a set of guidelines designed to ensure that medical experimentation would never again be conducted without the consent of the subject, and that human rights would always be at the forefront of medical research. But the legacy of the Nazi medical experiments lingers to this day. The stories of the victims, men, women, and children whose lives were taken for the sake of cruel scientific curiosity, remain a chilling reminder of the depths of human depravity and the horrific consequences of unchecked power.